It's 5 o'clock in the morning in the Valley of 1,000 Hills in KZN, and Dawn Lepan is on her way to work. But for her, it's not just work, it's a calling.
Oh, it is a joy for me. It is a joy. You have your bad days and your good days and your very bad days, but you have your happy times too.
Dawn's good and bad times are spent here at the 1,000 Hills Community Helpers, an NGO she founded in the late 80s. Around here, she's affectionately known as Auntie. As people from the area stream into the center, volunteers prepare porridge so that those arriving can begin the day with something in their tummies.
Running this kitchen is something like a military operation. Nearly 1,000 meals are prepared here every day, both breakfast and lunch. And for those who are fed here, it's literally the difference between life or death.
Thank you for the way so sweet. Thank you for the food.
Things had hardly got going when a request came for an ambulance for a sickly community member. This is the 1,000 Hills Community Helpers private ambulance, and it serves a population of about 26,000 people.
So we're just taking this patient back to the center. The center is our clinic to check what's wrong to that patient.
Without the ambulance, the sick would simply not have access to medical care. They can't afford to pay for transport to get to a clinic.
If you weren't here, how much support would this community get?
There would be no support. There would be no support.
Dawn's grandparents owned a restaurant in the Valley of 1,000 Hills, and this has always been her home. She's fluent in isiZulu and has a close relationship with the community.
My gran was very involved with the community. Anybody in the community who had a problem, they always used to come to gran. So one just grew up that this was your extended family and that is what you did.
In 1987, KwaZulu-Natal was affected by one of the worst floods in recorded history. Hundreds died and thousands of homes were swept away. Dawn's charity was born from this tragedy, with the help of a famous author who frequented their restaurant.
Alan Payton used to come every Sunday afternoon for crumpets and honey. There was so much warmth in his heart. I said, how can we help the community? And he said, well, let's start up a feeding scheme. And that's what I did.
Although she started modestly feeding people from the back of her bakkie, it soon became clear that this was not enough. The needs of the community were huge, and over the years she gradually realized her dream. First it was a feeding scheme, then a clinic, community support groups, a creche for over 100 children, a computer training facility, and the only library for miles.
Okay, what are we? 5.34.
There's something bittersweet about the Valley of 1,000 Hills. Alan Payton spoke of the lovely road into the hills and one of the fairest valleys in all Africa. But the needs here are immense. When Dawn first started her feeding scheme, the HIV/AIDS pandemic was in its infancy. Now it's overwhelming.
What has the impact of HIV/AIDS been here?
78% of our community is affected.
Infected?
Infected? Unfortunately, I don't have those stats.
60%.
As high as that?
Including adults and children and newborn. It's 60%.
Sister Dlamini heads up the clinic and sees up to 150 patients a day, and most of their ailments are HIV/AIDS related.
Are we winning the war against HIV?
No, we are failing. We are fighting the losing battle.
Dawn hears about deaths in the community at least 3 times a week. On her way home, she was called by 2 young boys unable to wake their mother.
When I arrived at the house, I could see that she'd passed on. And I checked for a pulse, and I sat on the bed with her. I didn't want to alarm the children. Granny came over and checked and saw that she was gone. And that was just part of another day.
Blanche.